Good afternoon, everyone. Thank you so much for joining us today. And thank you, Allie and IRHA, for inviting us to share today's topic, Medicaid coverage for pregnant women, timing matters. I am the program director for the Indiana Healthy Families Alliance, or IHFA, and I'm joined by two program coordinators from our team, Bryce Wray-Nelson and April Cash. I'm really happy they could both be with me today for today's presentation. Before we jump in, I do want to take a moment to share a little more about IHFA and the work we do. IHFA is a statewide program led by the Indiana Rural Health Association. Established in 2019, we are fully funded by the Centers for Medicaid and Medicare Services. IRHA is a three-time consecutive sole Indiana recipient of this CMS funding award. At the core of our work, we focus on identifying uninsured children, parents, and pregnant women who may be eligible for Medicaid and the Children's Health Insurance Program. And our primary goal is to reduce the percentage of Indiana's uninsured children. We do this by providing direct consumer assistance through a team of licensed navigators who help families apply, enroll, and renew coverage in Hoosier Healthwise and the Healthy Indiana Plan, or HIP. We partner with organizations to help reduce barriers, simplify the process, and make sure families can access the care they need. Now that you have a better sense of who we are, today's topic really reflects the work we're doing every day, helping families access coverage at the right time and avoid delays. I've outlined what we hope you will take away from today's Lunch and Learn. The goal is to make this informational practical, whether you're here supporting others or looking for answers to questions for yourself and your family. We'll start by walking through the Medicaid coverage options available for pregnant women in Indiana. We'll spend some time talking about timing because this is really the heart of today's conversation. Knowing when to apply or when to report a pregnancy can make a big difference in how quickly coverage and care begins. From there, we'll talk through some of the common issues our team of navigators are seeing right now, what's causing them, and what can be done to help prevent those issues. And then finally, we'll talk about how IHFA can support you either as individuals or as an organization, connecting others to the right support. We're going to walk through this in a more of a question and answer format because we found that this is the best way to address the real day-to-day questions and issues we're seeing right now. And a lot of what we're going to cover comes directly from those conversations. So our goal is just to make this feel practical and relatable, not just informational. When we were thinking about the topics we wanted to cover, this topic seemed extremely relevant because of what we're seeing right now. A lot of issues surrounding pregnancy Medicaid that have led to delays in care and a sense of general confusion about when to apply or when to report a pregnancy to FSSA. So we often encounter situations where pregnant women are doing everything right, but still running into issues. A lot of this really does come down to timing, either things happening later than they should, or people just not being armed with the right information at the right time. As we dive in, rest assured, we will discuss what those issues look like in real life and break them down so you'll better understand what's causing them and what can be done to help prevent them. So, Bryce, I'm going to start with you. You ready to get started?
Absolutely.
All right. Let's begin with a simple question. What Medicaid coverage options or programs exist for pregnant women here in Indiana?
So this is a great place to start because this is one of the most common questions that we get. And now, before I walk through these, I do want to mention that three of the four programs listed here, we actually covered in much more detail during our last Lunch and Learn on March 19th, when we explained how to apply for these programs. So if you joined us for that, some of this may sound a little familiar. If you missed it or you want a refresher, we do have that recording available on IRHA's YouTube channel. And Allie, thank you so much for dropping that into the chat for everybody. And so for now, I'm going to be providing a high-level overview of the most common Medicaid programs for pregnant women, so we can focus more on how timing plays into all of this. So, looking at the options, Hoosier Healthwise Package A, this is going to be the primary full coverage Medicaid program for pregnant women. This is typically what most individuals will qualify for if they meet income and eligibility requirements. Next up is HIP maternity, which applies to individuals who are already enrolled in HIP and then report a pregnancy. Once that pregnancy is reported, their coverage is then adjusted to better meet pregnancy-related needs. And then we have Package B, emergency services only with pregnancy coverage. And this is more limited coverage, and it's typically for individuals who don't qualify for full Medicaid due to immigration status. It is not full Medicaid coverage, but it does cover labor and delivery services related to pregnancy. Excuse me, and services related to pregnancy. I misspoke on that. And finally, presumptive eligibility for pregnant women, or PEPW. This is going to allow qualified providers to grant temporary, immediate coverage while a full Medicaid application is being processed.
Great. And you did mention eligibility and income requirements for those programs. And again, we did cover that in length, income and eligibility requirements at our last Lunch and Learn. So again, if people are interested in looking at those, definitely go back and watch that or rewatch that as a refresher. I do notice also, Bryce, that fourth option that you mentioned, and that is presumptive eligibility for pregnant women, or I think you referred to it as PEPW. Since we did not discuss that program in the past, can you tell everyone a little bit more about it?
Yeah, absolutely. And I'm happy to do this because it's a really important option that not everybody is familiar with. So, PEPW is essentially a way to get immediate temporary coverage. So, instead of waiting for a full Medicaid application to be processed, which can take really, in most cases, about 45 days, PEPW allows somebody to get coverage right away. What's unique about this program is that it's only provided by qualified entities, which are typically places like hospitals, OB offices, or community health centers that are authorized to make that initial determination. So if someone goes in for care and then appears to meet PEPW eligibility, those providers can actually enroll them in this temporary coverage on the spot. So, what PEPW enrollment does is cover care while a full application is pending. So, things like prenatal visits, pregnancy related labs, medications, and outpatient services aren't delayed. And it's just as important to understand what it does not cover. It focuses only on pregnancy related care. So, this is not going to cover ongoing care or routine services for conditions that are not related to pregnancy. Services like dental, vision, or other preventive care outside of pregnancy are not included, and it won't cover postpartum coverage or coverage for the newborn after delivery.
Thank you for explaining that. I think that's really helpful to understand how PEPW can help bridge that gap, like you said, while a full application is pending, and specifically more what it covers and what it doesn't cover. So shifting back now to applying for one of those three main pregnancy or those three pregnancy Medicaid programs you outlined earlier. I think this is when we're really going to start to see how timing really matters. Can you tell me when a pregnant woman should plan to apply for full health care coverage with pregnancy benefits?
Absolutely. So, this is probably one of the most important takeaways from today. The short answer is apply as soon as the pregnancy is confirmed. And I know that sounds simple, but what we see in real life is that a lot of people wait And they're waiting for reasons that seem logical at the time. For example, we'll hear things like, well, I'm just going to wait until my first OB appointment, or I'll apply once I know more. But the reality is, waiting for that first appointment can delay coverage by several weeks, especially if that appointment is scheduled a month or more out. We also see people wait until they get some kind of notice about their coverage, triggering a sense of urgency, like visiting the pharmacy or their doctor's office and learning that they don't have coverage, or even worse, until receiving a bill and being told that something isn't covered. Another situation that we see is people waiting until something feels urgent. Maybe they're having complications or they need immediate care. And that's really the last time you want to be starting the application process because at that point, you're dealing with both a health concern and you're trying to figure out coverage at the same time. So, really, the main goal is to get ahead of all of that. So as soon as the pregnancy is confirmed, even if it's still early, even if there are still questions, that's going to be the time to apply. Because what we're seeing is that applying early really helps to set everything else up to go more smoothly. When someone applies early, it gives them earlier access to things like their prenatal visits, their labs and screenings, and any additional monitoring that might be needed. And we know those early appointments really do matter. Now, on the other hand, when someone waits to apply, that's when we start to see issues come up. We see delays in care getting started, gaps in coverage, and in some cases, more complications simply because care wasn't able to begin as early as it should have. And these are very real issues that we do encounter. We see pregnant women who wait to apply for health coverage until they're 20 or sometimes even 25 weeks along. And because of that, we learn that they've not had consistent prenatal care up until that point. And then we're trying to get everything in place for them later in the pregnancy instead of early on, but which that's the goal, early on, right? So really applying early is not just about coverage, but it's about making sure that care can start at the right time.
Yeah, I think that really does highlight how important timing is for someone applying for coverage for that first time during a pregnancy. Um, I want to shift gears a little bit now because not everyone might be starting from that place. A lot of individuals may already be enrolled in a Medicaid program like HIP, let's say, and then they find out they're pregnant.
Mhm.
That might create a different kind of confusion because I know in my history working with people that there can sometimes be an assumption that since they already have coverage, that everything's just taken care of. So Bryce, what does timing look like for someone already enrolled in a Medicaid program like HIP, let's say, and what should they do then when they learn they are pregnant?
Yeah, so this is where we see a really important distinction from what we just talked about, right? So for someone who already has coverage, this is not about applying. It's about reporting a change. And the timing here is just as important. The goal is to report the pregnancy to FSSA as soon as they know they're pregnant. What we're experiencing here, again, in real life, is that we see, pretty often that individuals just assume that their coverage will automatically adjust or that their provider will be the one to report their pregnancy for them. And that's not typically how it works. And even though they already have coverage, if that pregnancy is not reported, their plan may not reflect the benefit coverage they actually need during pregnancy. And, just like when applying, we see people wait, but for slightly different reasons. They may wait until their first OB appointment or until something comes up with coverage or until they're told something is not covered. But during that time, they're still in their original coverage type, which may not fully support pregnancy-related care the way it should. So, reporting early helps to make sure that their coverage is updated appropriately, they have access to all the right benefits, and there are no delays or surprises when they go to receive their care. So, while it's a different step than applying, the takeaway is really the same. Early action makes a big difference.
We do have a couple questions in the chat I'd like to address. I'm assuming that the slides are available to be shared afterwards. Okay, just one confirmation from the team. We will get that sent out to everybody that's been on the call today. And then we did have another question. Does PEPW cover maternal fetal medicine appointments?
That is a great question. So can we
Can
get a
you,
little bit
yeah,
more
yeah.
detail?
So you mean like, and this is just where I'm not familiar with the types of
Mhm.
appointments. I'm going to answer it by saying it will cover anything related to the pregnancy itself, that specific pregnancy. If there's questions about that, I would suggest working with the doctor's office and their billing department to ensure that that is something that PEPW does cover. I know it covers prenatal appointments, but I don't want to lump all prenatal appointments into one category and answer incorrectly. So to be specific, I would reach out to the billing department. April, you have anything to share on that?
Just anything with that pregnancy diagnosis code on it should be covered.
Yes, they clarified that they were wondering if you're referred out to an MFM specialist, but it sounds like double check. But
Yeah,
since it's pregnancy related, we suspect that it will be.
definitely. Yep, thank you. All right. Yeah, and Bryce, I think that's helpful what you mentioned there because that distinction between reporting a pregnancy and then just applying for pregnancy is really important. And just to kind of reiterate what you had said, for someone who already has Medicaid coverage, the action is different in that they are not applying for pregnancy coverage, but they do need to report their pregnancy. So they're not starting the application process again. And they will want to do that as soon as they know they are pregnant so their case can be updated. And then just keeping with this practicality theme, I want to ask you, can you walk us through exactly how a current Medicaid member would go about reporting that pregnancy to the FSSA and what steps should they take and what does that process actually look like?
Yeah, so that's a great question, Anne, because this is the part where we really want to make this as simple and actionable as possible. Because because something can happen, we want to make sure we give a very simple steps here. People can do this right away. If someone already has Medicaid and needs to report a pregnancy, there are a few main ways to do it. So the first option is actually calling FSSA or the Division of Family Resources. This can be a good option for someone who prefers to talk to a real live person. But I'm going to be honest, we do hear from clients that phone wait times can be pretty long. So we do recommend calling early in the morning. Also keep in mind that it may take more than one call to get everything fully updated. That second option is reporting it online to the FSSA benefits portal. And this is usually the fastest route if somebody already has an account set up and if they feel comfortable using that. So they would just log in, go into their case, and report a change, specifically that pregnancy. Now, where we come in, and what we really recommend is the third option. Working with an IHFA navigator, because what we're seeing right now is that even when people do report correctly, the report of change can still get stuck. Supporting documents don't go through, or the FSSA notices can be very confusing, and sometimes next steps are being missed. Now, our IHFA navigators help individuals walk through the process step by step. We've got a great team. They make sure that pregnancy is reported correctly, they upload documents the right way, follow up if something doesn't process. And here's where IHFA makes all the difference. They stay with that person until everything is actually updated. So they are walking through that whole process with that individual step by step until it's completed. Now, ultimately, no matter what route somebody takes, there are a couple things that they're going to want to have ready, right? Typically, FSSA is going to ask for an estimated due date and pregnancy verification. So, pregnancy verification can usually be obtained from a doctor's office or a clinic, usually in the form of a note or an end of visit summary. And I do want to pause here and mention something really important because this is where we see a lot of confusion. Even though we are saying report the pregnancy as early as possible, relaying that you're pregnant to FSSA is just step one in that reporting process, right? So there are actually two steps that need to be taken. First, you report the change, and then the second step is submitting documentation to verify the pregnancy. Now, until that second step happens, the change may not actually be fully processed or reflected in the person's coverage. We've worked with several clients who told FSSA they were pregnant and assumed everything was updated, and then they went to have an appointment and found out that their coverage had not changed yet. And when we were asked to look into that, we often see the delay is because of verifying documentation wasn't submitted or it just didn't go through correctly. So again, it's not just about telling FSSA you're pregnant, but it's also making sure that the pregnancy is verified through a supporting document to complete that entire report a change process, right? So the tip we always give our clients is this. Let FSSA know you're pregnant as soon as you know and get that documentation to them as early as possible rather than waiting to be asked for it.
Yeah, that is helpful. I know, Bryce, sometimes I still hear a little pushback or confusion from people that I'm working with, and they say something like, I don't really understand what the big deal is about reporting my pregnancy. I already have Medicaid, and I know my coverage is comprehensive, so it should cover pregnancy-related services. How would you respond to that? What would you want that person to understand about why reporting their pregnancy does matter?
Well, I mean, that's a great question, Anne, and I'm really glad that you brought it up because reporting a pregnancy might seem like a small step, but it has a huge impact on what coverage actually looks like. When a pregnancy is reported, it triggers the correct coverage category. And that's important because not all Medicaid coverage is the same. That pregnancy category is specifically designed to support both mom and baby because it can expand benefits, reduce or eliminate cost sharing, and it opens up access to providers and services that may not have been accessible before. It also improves access to care in a very real way, meaning fewer barriers when scheduling pregnancy-related appointments, getting your labs done, or receiving specialized care if that's needed. But one of the most important pieces, and something that we can't stress enough, is continuous coverage. So, when a pregnancy is reported and processed correctly, it helps ensure that coverage is not just during pregnancy, but through a 12-month postpartum period for Hoosier Healthwise and HIP maternity members. Without that step of reporting and verifying a pregnancy, there's a very large risk that coverage won't align with what's needed or that there could be gaps in coverage at a time when care is essential. So when we say reporting a pregnancy is critical, we really mean that.
So I think we're going to take a minute here and just kind of process and pull together all that we've learned so far. And I apologize if you can see my cursor flickering all over your screen. My mouse chose this time to need a new battery. Uh, so it's kind of got a mind of its own right now. But again, let's just pause for a minute and pull together what we've learned because I think it's really important. And I think that there's a really clear theme in what we've talked about so far, and that is that timing component. What we've seen is that timing really matters in two key moments. Um, First, when someone is applying for Medicaid, making sure they apply as soon as pregnancy is confirmed, or even if that when they know they're pregnant, so there aren't delays in getting care started. And then second, when someone is already enrolled and needs to report a pregnancy, making sure that change is reported and verified, so the coverage reflects their needs. And then both of these steps are equally important because ultimately a delay can impact access to important prenatal and postpartum services. Um, and now I'm going to switch my attention to April, another one of our program coordinators April, I know you thought you might be off that hot seat for a minute, but not just yet. If you've been joining us for our monthly Lunch and Learns, you may recognize April. But April, although new to our panel, is definitely not new to our team. She's been with us since 2022. Before joining IRHA, she worked at a federally qualified health center where she oversaw outreach and enrollment services. So she has a lot of firsthand experience helping individuals navigate the exact processes we're talking about today. April became a licensed Indiana Navigator in 2016 and completed her certified application counselor certification through CMS that same year. In 2023, she earned her community health worker certification and served on the first advisory committee for the Indiana Community Health Workers Association. These are just a few of April's many accolades. April, what stands out about you to me the most is your passion and dedication to improving the health and quality of life for Hoosiers. So as we move into this next portion of our discussion on common issues related to pregnancy, Medicaid, and timing, I'm really excited to hear from you specifically because you experience these situations firsthand every day, and you work with people directly to help them navigate the steps we've just discussed. So, April, my first question to you is, or request, is can you give me a high-level overview of what you feel are the most common issues that pregnant women are experiencing when applying for pregnancy Medicaid or reporting their pregnancies to FSSA?
Yes, Anne, and thank you for your kind words for having me today. Your first question to me is an important one because on paper, the process of applying for Medicaid or reporting a change to Medicaid, such as a pregnancy, seems pretty straightforward, but in real life, there are a lot of barriers that can slow this down. One of the biggest issues that we see is related to the mail delays. The process of applying for and reporting changes to FSA still really heavily relies on the mail, and sometimes notices arrive late or they don't reach the individuals at all. We often hear clients say they never got anything, and in many cases, that's a very real experience from their perspective. Us as a navigator, when we're brought in to review a case and help them, we may see that a notice was sent to them with a deadline, but if they didn't receive the notice in time, it puts them at a disadvantage when they weren't able to reply to it. So instead of being able to move forward smoothly, we end up having to kind of backtrack and resolve something that could have been avoided with a more reliable delivery. Another challenge is understanding and interpreting those FSA notices. A lot of times these letters can be very confusing and hard to understand. And honestly, in today's digital world, we don't always expect something important with a quick due date to come through the mail. So it's really easy for those notices to get overlooked or set aside. From the client's perspective, they may not even realize that something's being asked of them. And again, the tough part is that these requests usually come with a very quick deadline. So if someone doesn't respond in a timely manner, that information or that deadline is missed and result in their application getting denied or prevent their coverage from being upgraded to include the pregnancy benefits. And then there's the FSA benefits portal. A lot of clients will have trouble setting that up or have issues with their username and password, maybe forget their username and password, and just general login and technical issues. Also, a factor that people don't always have reliable or consistent internet access, and we see this especially with our rural areas. Uploads to the portal can be an issue as people don't understand how to or where to go once they're in the portal, or they're only a portion of the upload goes through and it's not always legible. We've had clients upload something multiple times to FSA just to be safe, and then they still get a notice of termination or find out that the report of change has been kind of left sitting there because of issues with uploading documents through the FSA benefits portal.
Yeah, I agree with all of that, April. I still work directly with families in my position, and I know that these are very real and common barriers uh, that people face. So we've talked about challenges that people, families, face specifically as a navigator, and with the experience you bring from working through these cases day in and day out. What challenges are you facing as that specialist that people turn to for assistance? And what are some of the common barriers you face as the one troubleshooting cases?
Yeah, I really appreciate you setting it up in that way because it does seem that there's more things as case managers that we're having to deal with right now. A lot of these are system related and not the client's failure. The individuals and families that we're working with are trying to do their best. They're trying to follow the instructions and submit the documents on time when they know about it and respond to the requests by following the directions provided to them by FSA. But the system itself can be very difficult to navigate even when they're trying to do everything right. One of the biggest things that we're seeing in those cases with pending documents or information is just kind of sitting at FSA longer than expected. So even after someone has applied or reported a change and submitted their documents, there still can be delays in processing, and during that time, people are often waiting and sometimes without a clear update on what's happening next. We're also seeing more situations involving missing or delayed or inconsistent verification notices from FSA. And what I mean by that is it's not just that a notice might arrive late or not at all, but sometimes the expectations and directions on what's being requested isn't always clear. I'll give you an example. Let's say someone has applied for pregnancy Medicaid and they receive a notice from FSA asking for income information to complete their application. Let's say they're self-employed and they're asked to verify their income for a specific month, say March. And what they believe is being asked of them, they'll write out a statement explaining their net profit and loss for the month, and then they turn it in. From their perspective, they've done everything right. They've responded on time. They've provided the information that they thought was being requested and made a good faith effort to comply. But the issue comes up when the documentation isn't accepted by FSA because it wasn't submitted on a specific state form, even though that requirement wasn't clearly stated in the notice. Then they receive a follow-up notice from FSA stating their application was denied, often has a generic reason like failure to comply or failure to provide income information. Or they go to the doctor's office and find out their coverage hasn't switched over to reflect the pregnancy. This leads to confusion, frustration, because from the client's perspective, they did submit the information and they did it by the deadline. It also puts extra time on and requirements and demands on us navigators as we're trying to figure out what went wrong.
So that's a great example. And I know that this did indeed really happen, because I was brought in on this case to provide some oversight. I can tell you this, that we still are working to get to the bottom of that application denial. And since we never saw an official policy change, regarding reporting self-employment on that particular state farm and only that state farm, we are still unclear if this was or is a true requirement moving forward. So again, we're looking into that. So thank you for sharing that example because again, we're trying to keep this very real life today. I also know we've spent a lot of time on this. So I completely understand what you mean when you say in your slide, exhausting or extraneous follow-up.
Yeah, exactly. Situations like that one does put more demands on us as like a case manager. They just require so much more follow-up. And it does feel like right now there is just a constant kind of back and forth between calling FSA and making sure information is being processed correctly, submitting documents, sometimes resubmitting documents, just to try to keep things moving in the case. And that's what I mean when I say the process itself is just more demanding.
You did have a question come in, April, regarding your work. Do you also help with SNAP and TANF benefits?
So our grant is specific to, health coverage and applying for Medicaid. We can assist in doing the application, and sometimes the casework kind of gets crossed over with health coverage. So kind of do that on a case by case basis on what we can guide the client to with what they're doing. But the clients will have to do like interviews and stuff like that on their on their own for those programs, but we can kind of guide them through that. So also there's been legislative changes, specifically SB1 that passed last year and returned to the normal operations following the end of COVID-19 coverage protections. Just put more requirements on the members and subsequently us navigators. So essentially what we're dealing with now is more documentation requirements. That's increased troubleshooting demands and case delays as FSA tries to work through a high volume of cases.
Yeah, thanks, April. And then just circling back on that question about SNAP and TANF, I think April did a great job kind of explaining the extra case management demands that have been put on us as case managers. We would love to do more SNAP and TANF because it does go so hand in hand. And those applications go to the same eligibility determination office, which is the FSSA. One thing I will say, certainly when we encounter people who are interested in that SNAP or TANF application, we give them very clear direction on how to do that, or if they need additional assistance, we give them a referral for other agencies to work with them on that. So really good question. We would love to be able to do that. It's just that we have to keep our priorities in check and stay in scope with our grant. So April, again, thank you for walking through that because I think what you shared really does paint that clear picture of what this work looks like for you and for us day to day. And I also feel it's really important for people to understand that IHFA goes so far above and beyond just helping someone fill out an application online. What you described is real hands-on, ongoing support. You're meeting people where they are, helping them work through challenges that aren't always straightforward, and staying with them through the process. And I know as the director, that's something we take a lot of pride in. And I believe what really sets us apart and has led to our success. And that is that we do provide that very personalized support that you described, because we know that no two situations are the same. Every family comes to us with a different story, different barriers, and different needs. So it's not just working with someone to get their application submitted. It's about making sure that we are getting everyone the actual help they need and when they need it. So to wrap up, April, I want to give you one last opportunity to tell everyone what they can expect when they work with an IHFA navigator and how your experience and expertise comes into play.
Yeah, absolutely. I think we work really hard to meet people where they are and understand, what coverage options are available to them, what steps they need to take to get enrolled in Indiana Medicaid or CHIP program. Just as importantly, what they need to do to keep the coverage once they have it. One of the biggest ways we support people is helping them gather and submit their right documents up front. I think it makes a big difference on the application process when we have those documents up front. And I know that sounds simple, but whether they're applying, renewing, or reporting a life change, such as a pregnancy, paperwork really makes a big difference. And we're helping make sure everything is submitted the right way so we can avoid delays later on because something was missed or not accepted. We also spend a lot of time helping people set up their FSA benefits portal so they can independently manage their benefits. For a lot of the clients, that alone can be a challenge. So we try to walk them through step by step to make sure they understand how they can manage their accounts online. We also troubleshoot case issues a lot. I feel like lately that's probably the biggest thing that we're doing. And when something doesn't go right or expected, something's not processed timely or correctly, we can step in and try to help them figure out what's going on. And we're just continuously reviewing the notices and checking case status, trying to guide the clients through the next step. If a decision comes back that doesn't seem right, we can also help request an appeal or a fair hearing with FSA. A lot of people don't realize that that's an option, but it can be important just to make sure that their cases get another look. I think the biggest thing that we do, and probably the most important of all, is that ongoing support that we provide. We stay connected with the clients, we follow up with them. We're there when they need us. It really does become kind of a relationship, and our goal is to make sure that they continue to get the care that they need when they need it.
We
Oh,
have another question that has come in. Can you guys explain how an individual initially reaches out to a navigator? Do they find you online through a benefits portal or by calling FSSA? Um, and maybe also to add on to that question, how might some of our partners get some materials from you if they want to post your services and make them available to their clients?
well, excellent segue. Because we are definitely going to get into that next, talking about our partnerships and how to contact us directly. April, before I get into that, again, great segue. Thank you for sharing. It is just really always great to hear from a navigator and you as that boots on the ground person to understand not only what the people you're helping, the issues they're facing, but what are your challenges right now too. So thank you for that. And I think everybody can see again how your passion just really shines through. And I think you're a great example of IHFA's heart. So moving on, I do want to talk about that connection that we have with our partners, because we feel that with families, our families, most of the time, um, that initial introduction does come from our community partners. Um, so partnerships really are the key that opens the door for us to connect with families. And in terms of pregnancy health coverage assistance, we know that pregnant women often connect with someone they trust first, and that's where our community partnerships play such an important role. Again, they're often the first to identify a pregnancy, and more importantly, they're in a position to encourage someone to take action right away. So, whether that's applying for coverage or reporting that pregnancy early. And that early connection really matters because when referrals happen early, it leads to earlier coverage, earlier access to care, and then ultimately better health outcomes. It also helps prevent a lot of challenges that we talked about today because we're getting involved sooner in the process. Another really important piece to that partnership is that it strengthens the connection to our team members like Bryce and April. When a trusted partner makes that introduction, there's already that level of comfort and trust there, which makes it an easier foundation for individuals to engage with us. And at the end of the day, that's what this is really all about, supporting better outcomes for both moms and babies. So really, if there's one takeaway from this slide, it's the earlier we connect, the better the outcome, and building on that even more, because community partnerships absolutely strengthen our ability to reach families earlier. It's just as important to us that we show up for our partners. We really work hard to support the organizations we partner with so that together we can serve the communities we're all trying to reach. So connections. Oh, first I'll tell you what we do for our partners. And to answer your question, anybody can be a community partner. We don't have stipulations about who we partner with, so we invite and welcome everyone. And one of the biggest things we do to help and support our partners is we provide them a direct access line to our licensed experts like April. There's never a cost for our support, and it's always complimentary. And we work with residents statewide to provide that clear and accurate guidance so people can make really just informed decisions about their health coverage. We've made that referral process as easy as possible, and we've created a simple, straightforward way for our partners to connect individually to our team without adding extra burden on your staff. We know that's important. And because our community partner list is so diverse, we take the time to understand the needs of each organization so we can tailor our support to meet our partners' needs. So education is another big piece of what we do, whether it's formal or informal presentations or a lunch and learn like this one. We want to make sure we are always providing education and information to help all types of families feel confident navigating their health coverage. And then we also understand the importance of visibility, so we always embrace opportunities to collaborate with our partners in outreach endeavors. So really our goal when working with community partners is that they see us as an extension of their team as we work together to connect families to care. So contact information, and just before we wrap up for questions, more questions, I hope today's discussion really helped highlight how important timing is when it comes to applying for coverage or reporting changes like a pregnancy, and how when we work together, we can help remove those barriers. If you'd like to connect with us or you would like more information on partnering with us, you can connect us, and our information is up here on the screen. You'll also see a QR code. Um, I encourage you to use this, share it immediately. This is the way that you can connect with one of our navigators right away, be it first available, or you can select who you want to work with. And again, this is shareable. You can take it away, you can share it with your families. It's a great referral pipeline. So, at this point, thank you, April and Bryce, once again for joining me. It's truly a privilege to work with you both. I'm so grateful that our audience today got to get to know you a little bit better. So Allie, I think, and I've got a gazillion screens up here, so I can't see the chat coming in. It's just too much to monitor. So I'm going to stop sharing, and if we do have more questions, we'll go ahead and take those now.
So I've tried to keep up with the questions. We had several people reach out and say how wonderful it's been to work with April and thank you for the information. But I think we have kept up with the questions so far. As you'll see, we have launched our next poll. It's just 2 questions this time, but again, very helpful for us to collect the data to be able to continue having these free flex-funded lunch and learns. If anybody has other questions, please go ahead and drop those in the chat or Q&A, or at this time, if you want to use the raise hand function, we can unmute your line and allow you to ask your question verbally. So we'll go ahead and
Allie,
hang on the line. Yeah, go
yeah,
ahead.
Allie, I'm just kind of scrolling through the chat now, and I see that Kelly said we would love to have IHFA at our community baby shower in August. Well, Kelly, we would love to be there. So I will definitely reach out to you and see what we need to do to make that happen.
Yeah, I actually did grab that and emailed it to you too, Anne. So you
Oh,
would
thanks,
make sure
Allie.
that
You're
you have
you're
the
the
contact
best.
information. Yeah, of course. We do have is the best way to get the PEPW to connect them with a navigator.
Yeah, so PPWs are a little different, and I think Bryce kind of mentioned this in the presentation. So there's only certain entities that can offer, uh, those PEPW applications and determine that eligibility. So hospitals typically will do that, and federally qualified health centers. And to find a federally qualified health center, There is a website through HRSA. I don't know if I'm going to be able to find it in time to drop it in the chat, but if anybody wants that link to that locator, drop me an email or drop an email at Navigator. There you go. Allie, can I just keep you with me all day? Because this is great.
And
So
use
yeah,
that for
find
one
a
of
health
my other
center,
grants.
HRSA.gov. That'll connect you with an FQHC who do have those providers that can make those PEPW determinations.
Okay. Well, we will go ahead and keep the line open for just a moment longer, but I will thank everybody for joining us today. IHFA team, what wonderful information, very, very helpful out in our rural communities. We'll go ahead and end the recording, but we will hang on the line for just a moment longer.
Great. And then also see Kelly asked more specifically, can you explain how an individual initially reaches out to a navigator? We hope that you initially reach out to us at IHFA, but to find a navigator in general, you can use the Indiana Department of Insurance Find a Navigator tool, which you can just do a Google search, search Indiana Department of Insurance Find a Navigator.